Rural Americans deserve access to the best our nation has to offer, especially when it comes to health care. Across every state and every community, America's rural hospitals are the first line of defense, protecting our families, neighbors, and loved ones. No matter where you live, hospital care doesn't clock out. They're there 24 hours a day, 7 days a week, 365 days a year. Each year, America's over 5,000 hospitals care for millions of patients, providing 24/7 emergency care, delivering babies, cancer treatments, and other life-saving care that patients rely on. Behind every one of those patients are doctors, nurses, and caregivers working tirelessly to keep people healthy and safe. Hospitals are our community's lifelines. They employ our neighbors and keep our families' health. But now, some in Congress are threatening access to care. Tell Congress, protect patient care to keep America strong. Don't cut rural health care.
LifeLock, how can I help?
The IRS said I filed my return,
but I haven't.
1 in 4 tax-paying Americans has paid the price of identity fraud.
What do I do?
My refund, though.
I'm freaking out.
Don't worry, I can fix this.
LifeLock fixes identity theft guaranteed and gets your money back with up to $3 million in coverage.
I'm so relieved.
No problem. I'll be with you every step of the way.
1 in 4 was a fraud-paying American. Not anymore. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.
In the squadron, they called him Bullets, but we call him Greg Kelly. Greg Kelly is on the air on the Red Apple Podcast Network.
General Holt is on the line. General Blaine Holt, new call sign, the Wizard, or maybe we'll call him the Oracle. Or, oh man, General Blaine Holt, U.S. Air Force retired. I spoke to him last Wednesday, and he said the bombs will start falling soon after the stock market closes on Friday. And that night, I'm like, they haven't started falling yet. They fell, all right. They fell. It started right when he said it would start. Amazing work, General Blaine Holt. How did you know?
I appreciate that. Blind squirrel finds nut, film at 11. But I also know what the luminescence of the moon looks like to night vision goggle wearers, and you really want that to be dialed in. So those two factors kind of got us to where we are, and the politics, of course.
By the way, talk about that night vision goggle stuff, because I use night vision goggles myself. And the curious thing about night vision goggles, you don't necessarily want to use it when it's full moon, and you don't want to use it when it's no moon. At least the night vision goggles that I used in the 90s. They didn't work well if there was too much moon, and they didn't work that well if there was zero moon. What moon did we have the other night?
Still the case. We were up closer to 78%, I think is what it ended up being, but 62 to 80% is really kind of the sweet spot for using NOGs. And, I remember flying into Bagram with a C-17 in a snowstorm, not to make it any more cool, but half the runway was taken out for construction. And with the snow and the bad luminescence, we could barely see anything. And so I know President Trump wants to de-risk everything he can for our service people. And so I'm certain that they painted to him, this is a very, very good opportunity for us.
Well, that makes a lot of sense. By the way, personally, I hated flying with NVGs. I thought it was harder to fly. I'd rather fly in the pitch black than wear those things. It messed with my depth perception. It just was totally weird. I couldn't stand them. Except if I was flying low level, I kind of liked them. But landing, oh my God. So, all right, how is this operation going so far?
So far from what I can tell, we're off to a really strong start. We're not out of the woods. This thing could break left or right, but while we lament the loss of our 6 servicemen and women so far, servicemen, those losses are far, far lower than I would have thought after the first 48 hours of conflict with Iran. But we did exactly what a proper air campaign should do. This is to President Trump's credit. He handed it over to the experts. He just gave them the goals and the objectives, and they're meeting them in spades because command and control nodes, intel on the ground to tell us where the bad guys are, taking out launchers, intercepting missiles. It's not a perfect science, but as good as it could go right now, we're far better off than where I thought we'd be at this point.
All right. Well, sounds good. Hey, by the way, when we're looking at these videos that CENTCOM is putting out, like they'll show they'll show a vehicle like an old plane on a runway, or let's say let's say the Palace. Everybody has seen that video by now where the Palace gets blown up, and we're watching it. Are we watching it from a drone? Are we watching it from a military aircraft that dropped that bomb? What are we watching?
Typically, you're going to be watching that from a drone, from a MQ-9 or an MQ-1 Predator or a Reaper. But sometimes we'll even have imagery come in from space. But when we want to do proper battle damage assessment and things like this, and so you know that the critical targets, we're going to have real-time video feeds if we can have it. To the max extent that we can. And honestly, we've got assets there that are so good and so perfected after 2 fruitless wars in Iraq and Afghanistan.
Now listen to this. I don't believe it. I think it's fake news, amplified by the American media, but it's coming straight from Iranian state television. GK cut 8, please.
Screams of terror as cars and buildings engulfed in flames. One strike hitting an elementary school and killing over 100 people, according to Iranian state media. The US now investigating and working to verify that report, saying it would never deliberately attack civilians.
Never would. And also, what does happen though, authoritarian regimes come up with this story like every time, every single time. Now, maybe we make the mistake every single time, but I don't think so.
No, I don't think so either. We're going to investigate it properly, and if it's a fratricide, we're going to own up to it. Certainly not intentional, but I have never seen in all of my years of military operations, I have never seen more propaganda, more disinformation, deep fakes, outright lies than I have during this conflict. And I think it's all about there's no unified world that says, hey, it's great that the Ayatollah is gone. In fact, the world has not changed. In fact, there's this legion out there, it's global, that just wants to get Trump at all costs, no matter what. We will defend Venezuelan drug runners. We will defend the mullahs who are trying to make nuclear weapons. But we're going to create narratives, mainstream media, around the world that target Trump. And that's really all they're invested in.
Wow, that's amazing. Hey, this was a really cool moment. I mean, friendly fire does happen. It happens. It happens in every war. We minimize it, but 3 airplanes were shot down by the Kuwaitis, who are our allies, and it was a mistake. But listen to how it turns out. Cut 13, if you don't mind. Cut 13.
You need something to help you? No problem. You're safe. You're safe. You're safe. Everything good? No problem. Thank you for helping us. Everything perfect?
And it's a woman pilot. She's got a big smile on her face. She has her parachute hanging off her back. She just ejected, and she's happy, and she's probably flying a mission right now. I have never in my life seen anything like that. So immediate.
Rural Americans deserve access to the best of what our country has to offer, especially health care. Across every state, every community, America's rural hospitals are the first line of defense, protecting our families, neighbors, and loved ones. No matter where you live, hospital care doesn't clock out. They're there 24 hours a day, 7 days a week, 365 days a year. Each year, America's over 5,000 hospitals care for millions of patients, providing 24/7 emergency care, delivering babies, cancer treatments, and other life-saving care that patients rely on. Behind every one of those patients are doctors, nurses, and caregivers working tirelessly to keep people healthy and safe. Hospitals are our community's lifelines. They employ our neighbors and keep our families healthy. But now, some in Congress are threatening access to care. Tell Congress, protect patient care to keep America strong. Don't cut rural health care.
I think she said something like, well, these things happen. That's keeping her cool. Listen, it's a tragic thing where you have, maybe it's a training issue, maybe it's something else, where our 3 airplanes got knocked out in a vulnerable phase of flight on takeoff and departure. But the ejection life support systems all worked out. The Kuwaitis on the ground trying to help us out. And thank goodness they're all alive. I think President Trump's probably going to send the government of Kuwait a bill for 3 F-15Es. But this too will go on. I'm just glad it ended in a peaceful way. At the end of the day, the jets are rentals. but you can't replace those crew members, and we got them back.
Yeah, and these things do happen. It doesn't mean the war is off to a terrible start. These things happen. They do, and it's part of warfare. Do me a favor. Hillary Clinton in 2008. Cut 11, please. Cut 11.
If Iran were to launch a nuclear attack on Israel, what would our response be? And I want the Iranians to know that if I'm the president, we will attack Iran. Whatever stage of development they might be in their nuclear weapons program in the next 10 years, during which they might foolishly consider launching an attack on Israel, we would be able to totally obliterate them.
Well, it's very interesting to see her say that in 2008. I have seen hundreds of headlines since that say Iran is on the verge of a nuclear weapon. There was a time where some action like this would command bipartisan support, correct?
Right. But if she believed those words that she said, then why didn't she just resign as Secretary of State out of protest that Barack Obama did nothing to facilitate the end of their nuclear weapons program, the fake JCPOA agreement? So let's look at two presidents. You got President Obama, who sends airplanes full of cash over. We send airplanes full of bombs, and we don't bomb the Iranian people. We go take out their shadowy overlords that have done nothing but persecute the free Iranian people. Hillary Clinton's answer is, let's obliterate Iran. Are you kidding me? That's 90 million innocent lives. That's ridiculous. All you got to do is take out this terrible minority of death cult Shia Islamists, and then we have free Iran back, some of the greatest engineers, thinkers, and innovators in the world. And so what we want to do is not hijack a revolution. We want to allow the Iranian people to take back their country and let them pick their own leader, thank you. And then let's welcome them into the world community. And this gets to the big prize that President Trump wants, which is the Abraham Accords, demilitarized foreign policy. Let's bring our troops home. Let's all get back to business and trade with each other, and we'll make the world a better place.
Wow. Yeah, she did talk about obliterating the whole country. We don't want to do that. A lot of innocent people. You're right. All right. Blaine Holt, General Holt, what is something you want to say or that you want to be asked that you haven't been asked? I feel like, we ask you a bunch of questions, you answer them perfectly, but what is something that we might be missing that needs to be said, that hasn't been observed, whatever?
Okay, so I wrote an article on Newsmax.com. It's out today. Please go look it up on the Insiders page. But the thing I would say is Iran-Israel is not a stovepiped event. It is a battle in a much bigger global war. This war is with the financialists, the globalists, and the President Trump is doing a grand job lighting up the cartels, lighting up the mullahs, lighting up all the illicit activity. And all these craven people want is more war because that's what they've lived off of. You've got to understand this is a much bigger, complex event, and it goes right on through D.C., corruption, and all of it. But this is just one element of a much greater thing. And all these pieces, they're all interlocked. They all relate to each other.
Oh, man. And President Trump is fully aware of this broader campaign, this broader...
Crystal clear. When he lit up the cartels, I knew that he knew, because that's the vascular system to all of it. Absolutely all of it. This is beautiful. The strategy's working wonderfully.
All right. And one other thing, does he need to tell us about all that stuff? I mean, I'm going to go to your article, but I would like to be, should we all be let in on the secret here?
I would love it if he would do that. Sitting at the Resolute desk would be great, but at the same time, he'd be tipping his hat to a lot of folks who are running for it right now. Just look at the lawyering up of President Obama, the lawyering up of the Clintons. You're going to see a lot more of that in the days ahead because there's a lot of people with a lot of dirt on their hands who would really love to see this stuff go away.
Do me a favor. Just give me a little bit of a lead on what. Look, I have my suspicions about Obama, but what is he specifically worried about right now? He was the one who engineered that nuclear deal.
Yeah, well, he's got a lot of problems because he actually put the mullahs in business. He actually gave them a lot of money that would invariably go to killing our people. She's got Benghazi all over her. So does he. And there's been just a lot of illicit activity to indicate everything leading up to Russiagate, where he ran a shadow government on his own, which is antithetical to the Constitution and illegal. So, look, they're part of this globalist kill chain, this financialist kill chain. They're all part of that. And what the president's doing is putting a fire blanket around attempts to create a World War III situation, and then all this accountability can go away. Well, it's not going away. Everything from COVID, Benghazi, Crimea, All of it. It's coming. It's coming, kids. And what I'm going to tell you is, if you see a war, don't you think for 5 seconds that is a little war all by itself. Pakistan, Afghanistan, Cambodia, Thailand, Venezuela, it's all related. President Trump does know that.
Wow. All right. And we'll know it, too, right after I read your article. Thank you very much. General Blaine Holt. You're amazing, sir. Thank you. You told us exactly when this thing would start, and you were right. It's really, really cool. Thank you, sir.
Great to be with you. Thanks.
All right. To be continued. Hey, experts say this flu season is the worst we've seen in years. Either way, you know how this goes. Every year, someone in my family gets sick. Then everyone gets sick. And suddenly you're fighting to see a doctor. We're stuck waiting in a crowded urgent care. Not this year. I am ready. I ordered a medical emergency kit. And it's been a lifesaver. My kit is stocked with essential prescription medication, antibiotics like a generic Z-Pack to help you recover faster, amoxicillin for pneumonia, strep throat, and ear infections, plus prescriptions for nausea, UTIs, and they've got ivermectin in there. It's simple. Match your symptoms in the guidebook or call the telemedicine doctor standing by. Treat yourself early and feel better faster. No waiting rooms, no pharmacy lines. I love my medical emergency kit, and you should get one too. And I got you $45 off when you use my code GREG, which spells Greg. That's the code. Just go to urgentcarekit.com, urgentcarekit.com/Greg, urgentcarekit.com/Greg, and use that promo code Greg.
Thanks for listening to The Greg Kelly Show. You can hear The Greg Kelly Show weekdays at 12:15 on 77 WABC. If you like the podcast, share it with your friends and listen anytime at WABCRadio.com and download the WABC Radio app. Hit that subscribe button on all major podcast platforms. Plus, follow WABC on social on Instagram, TikTok, Facebook, and X. See you next time for a new episode so you never have to wonder.
What the heck is going on here?
Rural Americans deserve access to the best our nation has to offer, especially when it comes to health care. Across every state and every community, America's rural hospitals are the first line of defense, protecting our families, neighbors, and loved ones. No matter where you live, hospital care doesn't clock out. They're there 24 hours a day, 7 days a week, 365 days a year. Each year, America's over 5,000 hospitals care for millions of patients, providing 24/7 emergency care, delivering babies, cancer treatments, and other life-saving care that patients rely on. Behind every one of those patients are doctors, nurses, and caregivers working tirelessly to keep people healthy and safe. Hospitals are our community's lifelines. They employ our neighbors and keep our families' health. But now, some in Congress are threatening access to care. Tell Congress, protect patient care to keep America strong. Don't cut rural health care.